Hi everyone, I am Dr. Swati Kapadia, Senior Consultant Obstetrician and Gynecologist at Rainbow Children Hospital and Birthright by Rainbow Hospitals at Chennai. So today I am going to talk about high risk pregnancy.
So, can you elaborate and tell me what is the difference between the normal pregnancy and when does that become high risk pregnancy?
Yeah, most of the time, pregnancy is always considered as a high risk pregnancy, but not always it will go smoothly and uneventfully. So pregnancy is considered high risk when there are increased chances of complications and that would affect mother and a baby. It is called as high risk pregnancy. And in these cases, they usually need, these kind of pregnancies need um, a good specialized care along with the good infrastructure where the baby and mother they are having a safe outcome.
When do you know that this is a high risk pregnancy? How do you find out that, ma'am?
So there are certain conditions. For example, now if if mother is getting pregnant at an early age, before the age of 17 years, or if she is above the age of 35 years, so there is a risk that is considered as a high risk pregnancy. Secondly, sometimes a woman may have some pre-existing medical conditions, like she may be having high blood pressure, she may be having hypertension, she may be having diabetes before the pregnancy, some heart disease, some may have some kidney issues, and she may have some autoimmune disorders. So these are the conditions where we advise them to see a physician before they get pregnant. And there are some conditions where there's a family history of genetic disorders in the family. Then there are some conditions where there is a previous pregnancy adverse outcomes. Like in her previous pregnancy, she may be having premature babies, or she may be having stillbirths where the baby dies in the womb of the mother. Okay, there may be history of they are taking some drugs or some medications which are not really safe in pregnancy.
What are the risk factors? Does it apply to the child? Does it apply to the mother? What are the risk factors and where do they arise from?
First of all, is if there is a hypertension in the pregnancy, means high blood pressure in pregnancy. Then gestational diabetes in pregnancy, where the diabetes happens only during pregnancy. Then there is a condition called as cholestasis in pregnancy, where because of the pregnancy hormones, the liver produces bile salts, which causes some complications in mother and a baby. Then there are conditions where pregnancy is complicated by previous cesarean section or previous surgeries on the uterus, like fibroid surgeries, we call it as myomectomies. These are also considered as high risk. Then there may be a mother may be Rh negative blood group and father is a Rh positive blood group, where there is a risk for the baby in after delivery. Then there are certain conditions, like if sometimes a mother can get premature labor pains where she may get earlier pains than the expected date of delivery. Or there may be a history of cervical incompetence. In cervical incompetence, what happens? The mouth of the uterus, we call it as a cervix in our medical terms, which is not very strong enough to hold the baby, so they will have premature deliveries. Then comes the women who are conceived after infertility treatment like IVF or ICSI, and a woman who is having multiple pregnancies like twins and triplets. And then comes the pregnancy where there is a bleeding during pregnancy. So there are several reasons why there is a bleeding during pregnancy. If you see in the early pregnancy mostly if the mild bleeding is there, it may be normal, but sometimes it may be a sign of impending abortion, or it's a sign of ectopic pregnancy. And if the bleeding happens in the later part of the pregnancy, it may be because of the placenta previa, where the placenta is implanted lower in the uterine segment, and there is a premature separation of the placenta. And these are the conditions where the bleeding happens. So whatever is the reason for bleeding in pregnancy, these all pregnancies are considered as a high risk pregnancy.
There are certain conditions and complications that come up, ma'am, during pregnancy. Which amongst these can be stopped? Which amongst these cannot be stopped?
So there are complications which we can divide it into two parts, like complications in mother and complications in baby. So if you look at the complications in the mother, like if, for example, she is having bleeding in early pregnancy, she may land up into abortions. If she is having ectopic pregnancy, then she may need a surgical intervention where we sometimes have to remove her fallopian tube.
Okay.
Okay, and sometimes if there is a high blood pressure, for example, in pregnancy, or gestational diabetes, if it gets complicated, if it gets worse, and where as so much so that we might have to deliver a baby early. So there are chances of premature births, and in this condition, the woman has to get admitted in the hospital before the expected date of delivery. She may need admission in the hospital, and sometimes she may need to undergo some surgical intervention like cesarean sections. Baby, as well as I said previously, that premature deliveries do happen because of some reason, some medical conditions like hypertension or diabetes, where the babies are born low birth weight. Sometimes we call it premature babies. These babies need an ICU admissions, an ICU care, and sometimes these babies need some respiratory support. They may get jaundice, so we call it as a neonatal jaundice. And these are the babies who have high chances of getting infections during their stay in an ICU. So these are so there are complications in mother and baby as well because of the high risk pregnancy.
Can you tell me what are the most common fears or common issues that women come to you with or the couple comes to you with?
So they always are worried for whether the pregnancy will be safe. And any small issues, like anything happens, they are concerned nowadays because awareness is more than what was initial days. So nowadays awareness is more, so they are always worried, like they will, maybe sometimes they Google it out and come to you asking you questions beforehand, whatever is the issues. Like sometimes little pain in the abdomen, they are worried. Why doctors, why the pain is there, whether my baby will be safe or no, whether ultrasounds, what we are doing, we ask them ultrasound for pregnancy, whether it is safe or no, whether it will harm my baby or no. And so many questions about the pregnancy. They are always excited as well as worried.
So, is it true that lifestyle also affects the risk during pregnancy?
Yes, exactly. It always affect the risk for pregnancy. Lifestyle makes a lot of difference because for the same reason we ask them to go for preconceptional counseling, which is very important. So we ask them to come for preconceptional counseling, where we take a detailed history about what are the pre-existing conditions, if she is having any problems. We do a lot of investigations before even she is getting pregnant. And if she's having any medical conditions, like as I told before, any hypertension or any kidney disorders, heart disorders, we make sure she gets treated, and the problems are well optimized. So whenever she is pregnant, she is in her good health.
Before the pregnancy and during the pregnancy, are there any tests that you would recommend?
Yes, there are, like, we do ask them for certain blood test investigations. We do ask them to do ultrasounds in pregnancy to look for how is the uterus and how are the ovaries, right? And there definitely some routine checkups along with the consultation with a medical doctor if they are having any medical issues. We ask them to check for it's a general examination very first, where we do take the detailed history, okay, what she has, and then we do, once she comes to a clinic, we do go through all the things, like including the blood pressure, going for the ultrasound if she is required, and going for some major important blood tests, like to test for sugar, test for her blood, whether she is not anemic, okay, she is not having any infections in her body. Okay, so all those tests she has to go through. And if she's planning for pregnancy, usually we ask them to go for some test for rubella. If she is, for example, had rubella in the past, if rubella test is positive, it's not a problem. But if it is a negative, she needs vaccination before pregnancy. And if she has taken a vaccine for rubella, then after that she cannot be pregnant for 3 months because it's a live vaccine. So certain vaccinations are also important. Nowadays, again, the COVID vaccination is added. So COVID vaccine is safe during pregnancy as well, and for lactation as well.
How can it be prevented? How can risk be completely prevented? Is there any way that zero risk pregnancy?
For the same thing, like we advise them to go for preconceptional counseling, which is very, very important, where we do take their detailed history about, we do some blood tests, some ultrasound, and if she's having any medical conditions, like high blood pressure, kidney disorders, or heart disease, diabetes. Okay, so all these conditions are taken care before by consulting a physician, so that she is safe during pregnancy. She has very less complications during pregnancy.
Is there any high risk after pregnancy, immediately after they deliver? Are there any complications that can come up, ma'am?
Yeah, sometimes those women who have high blood pressure during pregnancy and who has, for example, gestational diabetes or diabetes during pregnancy, so if after the pregnancy, sometimes it may continue the same way. Like they may have blood pressure, and after certain age, then they might have diabetes in their pregnancy.
Can you please elaborate, Dr. Swati, that how is the facility, how is the treatment, how is the experience at Rainbow Children's Hospital much better?
Yeah, if you are having a high risk pregnancy, you need frequent visits to your specialist. You need to sit with your doctor. You need to know about what are the high risk situations, what are the symptoms to watch for, and when to reach to the hospital when there is an emergency. So, your obstetrician will give you a plan of management, and specially individualized for your symptoms, so that you have to stick on to that plan to optimize the outcome of pregnancy. And yes, if high risk pregnancy is managed well, managed in a good setup like Rainbow Hospital for Children and Birthright by Rainbow Hospitals at Chennai, it need not be a high risk pregnancy. You will always get good outcomes.
Absolutely.
So, you at Rainbow Hospital, Chennai, you are in a safe hands. You and your baby both are in safe hands.